communications firm, the Estepona Group, who are here today to review some example materials and messaging that we have been developing for this communications campaign. So I will start it off. Does anybody have public comment before we get started? I believe I see one. Molly, go right ahead.
Hi, folks. This is Molly Rose Lewis. I'm in Senator Jackie Rosen's office. I'm the healthcare person for Northern Nevada. We have a counterpart in the South, but I just wanted to let you know that I am here. And if there are questions that still need answering on the federal level that we can help try to get for anyone, please let me know. Thank you so much.
That's wonderful. Welcome. Thank you so much for joining us today. Is there any other public comment online? Okay, great. Seeing none, I am going to turn the presentation over to Ann Jensen, and I will start screen sharing our presentation and we can go ahead and get started. So Ann, I will kick it over to you.
Thank you, Chloe. Good afternoon, everyone. My name is Ann Jensen. I'm the Medicaid Director here in Nevada, and I'm excited to share a few updates related to the policy and program design for the way we'll be implementing this new federal law, so that way you all have a sense of where we're at in our implementation process and what the rules will look like as folks that are impacted by these changes go through that process. So if you move to the next slide, Chloe, or once you're able to share, it looks like maybe our connection is having a moment. Today I'll be walking through kind of a high level of what these changes are as a reminder for folks that weren't able to join our first workshop. I'll be talking about how the verification process will go and what data we use. And then I'll share a few updates related to outcomes from an interim final rule, which was published by our federal partners in early June. And then I'll wrap up by really showing two kind of anonymized examples of what this may look like for particular Medicaid patients in our community. So that way you all have a chance to kind of see how all these pieces fit together for the real people that benefit from Medicaid coverage and for whom we'll be working without this process or throughout this process, excuse me. So like I mentioned, overview and policy updates first. What does this look like for members? At that point, I'll turn it over to Chloe. As she mentioned, she'll be talking through our community education strategy, and then look forward to getting your feedback through our colleagues at the Estepona Group on some of the materials they've pulled together that will inform a toolkit for our community partners. So with that, Chloe, let's dive right into the policy components. I will note there is a lot of wonky Medicaid policy language here. We're trying to explain it in as clear a way as possible, but if you have any questions, please don't hesitate to reach out. We'll share our email address in the chat and also afterwards in our slides. That way you all can reach out with those further questions. So as I shared at our workshop back in March, there's three primary policy changes that are coming to Nevada Medicaid as the result of new federal legislation that was passed on July 4th of 2025. We've spent the subsequent year digesting those changes, working with our federal colleagues to really understand how states will be expected to implement them in preparation for a few really important dates. Those three changes, number one, two of them begin on January 1st, 2027. Numbers 1 and 2 are work and community engagement requirements and 6-month eligibility redeterminations. Taken together, what that means is for some adults that have health coverage through Nevada Medicaid, starting next year, when they renew their benefits or when people apply for coverage and they fall into that population, they'll have to show that they complete 80 hours per month of a qualifying activity or they're exempt or accepted in some way. Also, once they renew for the first time in 2027, a new clock starts. Rather than every 12 months needing to renew Medicaid coverage, those people will be renewing their health coverage every 6 months. So those are two pretty connected items, 1 and 2, because it's pretty much the same population that will impact. And again, that is starting January 1st, 2027. The third change is in a bit of a separate bucket. We won't be touching on much of this today because we do have a little bit more time. Our focus is absolutely on numbers 1 and 2, but we're beginning our preparations for implementing cost sharing or copays. Right now, Medicaid coverage is free to nearly every member that receives our health coverage program. There's a few exceptions for example, our Katie Beckett program, which allows folks that have higher incomes to be able to buy in to the program or pay a premium to receive Medicaid coverage. But for the most part, there are no premiums, there are no copays, no one has to pay money when they go see a doctor. Because of this federal law, there will be some small copays required for some recipients and some services starting in October 2028. You'll note me using the word some a fair amount in that sentence. That's because there's a lot of detail that's still to come in the regulatory guidance that we'll get from our federal partners. So I'll note that we don't have a clear picture quite yet of exactly how states will be expected to implement. We're taking what we do know from the federal law and are preparing for it, but look forward to receiving more guidance next year. I'll note there is one final change that I'll call out here. We shared more about this back in March. There are a few changes related to a number of legal immigrants that currently have access to Medicaid coverage. Because of the federal law, that access is changing, and that takes effect on October 1st, 2026. This is a pretty small population of people in our state, about 5,000. However, it's incredibly important that people know if their coverage is changing, and so those notifications have gone out over the past few weeks, and there'll be more information to come for our community partners on exactly what that looks like. But I'll note that is kind of the fourth eligibility change for a smaller population, not that adult and expansion population overall. So in summary, we're going to focus a lot on items 1 and 2 today, primarily number 1, but please know that number 2 will impact the fact that people will need to demonstrate they meet or are exempt from work requirements every 6 months. So with that, let's go to the next slide, Chloe. As a reminder, we shared this last time, none of this changed with our federal rule. So to be compliant with work requirements, an adult needs to meet at least 80 hours a month of either working, doing volunteer work or community service, participating in job training programs, or educational activities. Those can also be combined to be able to reach 80 hours. It doesn't have to be fully one activity. But an important question is, who actually needs to meet these requirements? And if you do, how do you demonstrate it? So our next slide, I will acknowledge, is a little bit busy, so bear with me as I walk through it. But is the attempt to show the 3-step verification process that's really outlined by the federal regulation and federal law here. So the first step, as an application, a particular person's application is reviewed. This is a new applicant or a renewing applicant next year, is to check, is this person excluded from requirements based on federal law? So that top right light blue box shows who is excluded, called specified excluded in federal law, from these changes. You'll see there's about 10 bullet points there. I'll just run through those quickly because it's really important to know if any of these apply to you or a patient that you care for, automatically that person is excluded and will not be asked for more information related to work requirements. So that is parents, guardians, or family caregivers of a child under age 14, or someone with a disability who needs help with daily activities, people that are pregnant or gave birth in the past 12 months, young adults who were in foster care up to age 26, veterans with a total disability, American Indian or Alaska Natives, people who are currently incarcerated, people who already meet work requirements for SNAP or TANF, which are food and cash assistance, and similar rules apply in those programs already, people that are in treatment for drug or alcohol use disorder, and people who are considered medically frail. You'll note a number of those categories aren't super clear how someone would fall into it, so I'll share a little bit more about how we're defining that shortly. So step 1 is, is someone excluded? If yes, they do not need to meet work requirements and they're automatically excluded. If not, then they move to step 2, which is to say, are you eligible for an exception? Exclusion and exception, similar words, very different meanings in federal law, so it's an important note that there's 2 different steps here. If someone makes it past step 1, that means that work requirements apply to them, but they may be mandatory or temporarily accepted from having to meet them for that particular renewal period. So those exceptions include being under age 19 before the work requirements were in place, being eligible for Medicare, having a recent stay in a hospital, nursing facility, or psychiatric hospital, needing to travel outside your community to receive medical care for yourself or a dependent, or living in an area with a federally declared disaster or emergency, or living in a county with high unemployment. So those are our exceptions. That would mean if you're eligible for them, you do not need to meet work requirements. If the answer to that question is also no, then it moves to step 3 on this verification process. And at that point, the question is, do you meet work requirements? Do you have a combination of what I showed on the past slide, which is 80 hours per month of a qualifying activity? If yes, that person is still eligible for Medicaid if they're financially eligible and they can renew their coverage or enroll. If not, that person would be deemed no longer eligible and is disenrolled from the Medicaid program. At that point, people have appeal rights and an ability to provide more documentation if they feel that judgment was not made appropriately. People also are able to reapply for Medicaid coverage within 1 month or 12 months down the line if their situation changes, but at that particular determination, they would not be meeting work. So I hope that's helpful. Those 3 steps are really crucial, and I hope that's a helpful way to describe what takes about 200 pages in federal regulation. And so it's our attempt to try to summarize that at a high level. You may be asking, how do you answer each question, right? What data or information is used to verify yes or no to each of those 3 questions? So Chloe, if you move to the next slide, this is our federally required verification process. So for each of those questions in the blue boxes, we have to go through these 3 steps. First, we have to check any and all available data to ensure that if someone is exempt or compliant with work requirements, we can use the data that we already have. So this includes things like wage data that we have a connection with right now, or unemployment data, or other information that we have automatic connections with. If we don't have an available data source, for example, someone needs to travel a long distance for care, we don't have a way to verify that with data. And in 2027, we are allowed to use step 2 next, which is to accept self-attestation. So what that means is people will be given a short screening tool, either online in kind of a real-time checkbox process or on paper, where they'll be able to attest that they are compliant or exempt by answering a number of yes or no questions or other information. Importantly, that has to be an auditable self-attestation, meaning a person has to have documentation available in case the federal government audits that particular case. However, we are not asking for any documentation in 2027. Federal law allows us to just accept that screener form or a check or information on that screener form as an auditable self-attestation. Step 3 comes into play for one case in 2027. For veterans' total disability status, we are federally required to get documentation on that piece. But starting in 2028, steps 2 and 3 are switched, and this is based on federal rule. We have to collect documentation before self-attestation is allowed. And self-attestation would only be allowed if there's no way to provide documentation of that particular situation. So I know that gets complicated fast, but I hope it's important. What I want folks to really hear is we're doing everything we can to not have to ask for more information. We can answer any one of those 3 questions with our data review. We won't include a screener in someone's renewal packet or their information. We won't request for people to give us more information. However, if we do, it's really important that we ask for it in a very clear and concise way. All of our screeners have gone through a really comprehensive review process to ensure they align with state and federal law, and also with reading level and other kind of best practices in communicating with our members to ensure it can be as clear as possible. And we're working through in preparation for 2028 to make the documentation submission process as clear and straightforward as possible to ensure as little administrative impact on our members as we can. So with that, I have about 2 more slides to go through on the policy front, and then we'll talk about how this plays out for particular members. So as I mentioned, the interim final rule was released on June 1st. It was about 300 pages, and our team has spent a ton of time digging into the complexity of this. And there's 2 key components that we received clarity on, that back in March we said, we think we can do this, but we're waiting for clarity from our federal partners on how we're allowed to. And those 2 items are short-term hardship and medically frail exclusions. So both of these would fall into that second question of the verification process. Is someone accepted from needing to meet work requirements? States have the option to allow for short-term hardship exemptions, which are those 4 that are listed here, and I have discussed them earlier. Nevada Medicaid will be moving forward with seeking CMS approval for all 4. What was clear in the rule is you can't just pick one. It's an all or nothing. You either implement all 4 or you don't implement any. We will be able to move forward in our systems and with the self-attestation process with all 4 short-term hardship exceptions at this time. The other piece that was made more clear in the federal rule is related to the medically frail exclusion. Importantly, the way it's defined in that regulation is that people will be excluded if they fall into one or more of the following 5 categories. So those blue categories below, and that their condition significantly impairs their ability to meet work requirements. It's a really important step. So it's not just that someone, for example, has a serious or complex medical condition, but that condition impacts their ability to work or to volunteer or to go to school. You can imagine there's a lot of complexity to what that looks like. We are working closely with our federal partners to ensure that the way we are developing our Nevada definition both reflects the really valuable public input we've gotten from you all and from our last policy workshop, and also aligns with federal expectations for this definition. We expect to have a final code set that defines this by the end of July or early August to allow time for our claims system to develop this algorithm, because we'll be using claims data to exclude people wherever we can without having to ask them for more information about their medical history. If someone applies and doesn't have any claims history with Nevada Medicaid, or maybe recently moved to the state, people can use a medically frail screener, so a supplement to that one I was talking about before, that would demonstrate a little bit more detail about their condition, that would allow them to qualify for that medically frail exclusion. So hope that's helpful clarity. We feel grateful for a clear path forward and continue to be on track for that January 1 implementation date. And are happy to speak to any details. Again, we'll drop that inbox in the chat and we can answer those questions there. So let's move now to a little bit more detail on what this can look like related for a particular member. So this is not a real person's case, but this is an example of what it may look like for one of our members. So Luke here lives in Pahrump and has been enrolled in Nevada Medicaid, receiving health coverage for the past 3 years through our program, which helps him get medication for his diabetes. This summer, he was diagnosed with lung cancer. Because he has to travel to Las Vegas for chemo, he is on leave from his job at the Holiday Inn Express in Pahrump, and his Medicaid renewal date is in May 2027. So step one is he eligible for work requirements? And the answer is, because he has a health condition that that would meet one of those serious and complex medical condition criteria and impacts his ability to work, he is considered to be a specified excluded individual based on the medically frail definition. So he does not need to meet work requirements. So to verify this, Nevada Medicaid would use our claims data algorithm that would demonstrate both his lung cancer and diabetes diagnoses, as well as his ongoing chemo treatment. In combination, that claims data would indicate that he would be qualified for a medically frail exclusion because his health conditions and that ongoing chemo outside of his home location would prevent him from being able to work. So when he receives his renewal packet by March 1st, which is 60 days before his renewal date, he will not be asked to provide any additional information related to work requirements. Instead, if he's financially eligible still, based on the regular renewal packet, he would be able to maintain his Medicaid coverage. So moving forward, his next renewal will happen 6 months later, in November 2027. So if he's still unable to work because of his ongoing chemo, he would be verified as excluded in the exact same way. He's back at work and is not, if we don't see ongoing chemo treatment in his care, he may actually be eligible for work requirements, but we would have the wage data from Holiday Inn Express as part of our overall employment data information to qualify him as eligible and compliant with work requirements. So he also wouldn't get a packet at that time. So that's a helpful way to kind of see how we would process it. We have one more case in the next slide that I hope will be helpful too. Julia here in Elko is enrolled in Medicaid recently because she lost her job. And this health coverage helps her get routine primary and OBGYN care for free. Her renewal date is 12 months from spring, so March 2027. Because she is not in any of those specified exclusion groups, she's considered an applicable individual. So she must meet work requirements to renew her health coverage. She'll get some information in September that to learn that she will that this applies to her, and so she starts to kind of review what her activities are like. Are the things that I'm doing compliant? So she loves animals and is volunteering at a local animal shelter part-time while she looks for jobs, and realizes or calculates that she's volunteering about 60 hours per month. To keep her Medicaid coverage, she needs 20 more hours of a qualifying activity per month and decides to enroll in a GED program. So in January, she'll receive her renewal packet in preparation for that March 2027 renewal date. Because we don't have data on her volunteering, right, or her GED program, we'll need to include that pre-screener and ask her for a little bit more information. So she'll share a little bit of detail on her volunteering and GED programs and how in the month of December, she was able to hit 80 hours in combination of those two activities. That packet will be sent in, or she'll complete it online. It will be processed and she'll be determined as still eligible for Medicaid because she's compliant with work requirements. The next time that she renews will be 6 months later in September of 2027. So either she'll still be volunteering and working through her GED program, or she may be working at that point, or some other condition may apply and we would reassess. So I hope that explanation is helpful to kind of think through how would this apply to a real person? Because that's the most important part of all of this. We are here to serve our members and ensure their health coverage is continuous wherever they're eligible. And so everything we're doing here is to make that as clear and straightforward of a process as possible. So in closing or in transition, I'll share one final slide here, which is what would Luke and Julia get in the mail next? What are they going to know? How are they going to know that these changes impact them? So on September 1st, about 280,000 Medicaid members here in Nevada will receive emails, texts, and mailed letters with information about these changes. You can view those notices on our HR1 website. Here's a little snippet here on the right of what the mailed version looks like. We tried to be as robust with information as possible, while also trying to keep it really clear. So we have it's about a 2.5-page letter. There's a lot of federal requirements about the information we need to include. And I just want to give a huge thanks to our Beneficiary Advisory Council and our Medicaid Advisory Council, whose members provided invaluable input. We had a working session where everyone had a draft of these notices and they provided real-time input on exactly what words we used and how we used them. And that's feedback from members who may be getting those notices, which is incredibly valuable, and I'm grateful for their input and support. So those, again, will be mailed out on September 1. And we recognize at that time, there will be probably a lot more questions, and there's a lot more information that people will want to know as they prepare for these changes in 2027. So that is really where our community education and broader education efforts are going to be really crucial, which is where Chloe and our Estepona team come in. So I'll turn it over to you, Chloe, and thank you again for the time.
I'm just going to briefly stop sharing for a moment while we move into the next section of our presentation. And Anne, thank you so much. That was very helpful. Monica, go ahead.
I just wanted to call attention to Anne that there was a question in the chat.
Do we want to stop here for questions and review what we have gone over so far, or do we want to wait until the end of the presentation portion to open it up for questions and feedback?
Thanks, Chloe. Given the timing here, I really want to make sure that we can get through some of the communications pieces in our discussion items. So I can respond to those questions here in the chat versus live, so that way you can keep going.
Perfect. Sounds great. Thank you so much. All right. Moving on to the communications focused portion of this workshop today. So again, my name is Chloe Chisholm. I'm the Public Information Officer for the Nevada Health Authority, and I'm working with Anne and her amazing team on really making sure that we push out this message about these new requirements that Anne just walked through effectively to our members. So I'm just going to do a high-level overview of our overall philosophy and strategy behind this campaign before I turn it over to the Estepona group for some really exciting updates on messaging and example materials that we've been working on developing. So our overarching strategy for our communication and outreach and education is really to ensure that this information about new requirements reaches our members clearly and effectively. We want to help folks understand what is changing and what they need to do to retain coverage. Bottom line, this is what's happening. If it applies to you, this is what you need to do. We're focusing on very clear and consistent messaging that is reassuring to our Nevada Medicaid members. And we are at this point in time, extremely focused on partnering with community organizations, our navigators and trusted messengers, really all of our stakeholders in this space to help us communicate in a way that reaches our members in the community, really meeting folks where they are. And the portion that we are working on very hard with the Estepona group is creating and distributing messaging, toolkits, flyers, resources, and continuing education to all of you to use and distribute as needed to our stakeholders so that you can confidently pass along this information. overall really working to emphasize support, resources, and pathways to members to maintain their coverage using plain and straightforward language as much as we can. As you all just saw, it can get very complicated. So want to avoid confusing industry jargon and really keep this down to the bare bones of what folks need to do. So this strategy is really broken up into two buckets. That's our targeted member outreach and our community education. You just saw an example of targeted member outreach in the form of a notice or a letter or a mailer that will have information specifically to members that we know are in this population about what they need to do, whether that's the initial mass mailer, whether it's a renewal packet or a request for information, sometimes notices of non-compliance, notifying members that they are not currently in compliance to keep their Medicaid, approval or denial letters for new applicants in 2027. And then the work doesn't stop once the implementation date does come around, really focusing as well on continuous outreach post-implementation to really help folks stay covered as these new requirements go into effect and as folks' renewal dates come up in 2027. The other side of that is the community education piece. So that's what we're doing here today, public workshops, focus groups, listening sessions, our stakeholder engagement, really creating that more broad community awareness and understanding of these changes. And as I mentioned before, fact sheets, brochures, resource guides, any additional materials that we can distribute to our stakeholders. That will also include social media and later in the summer advertisements and additional marketing activities. Really want to create a general awareness in the community that Medicaid eligibility and requirements are changing. And that is the focus of the more broad communication and education strategy. I'm sure many of you have seen this timeline before and are well aware of these dates, but just to quickly walk through our timeline that we're working off right now. The notices to our legal immigrant population that changes are coming for them on October 1st have been sent. Today is our public workshop on our communications resources and campaign and how we can really focus and work together with our stakeholders. Later in the summer, we will start working on additional marketing activities, whether that be radio spots, ads, additional awareness out in the community. And September 1st of this year is when those notices that Anne showed an example of earlier in the presentation will be sent out directly to members. Later in the fall, we plan on hosting an additional public workshop focused on what we've learned so far, any questions or concerns that we can answer, feedback and information that we gather and work on with all of our stakeholders here today. And January 1st is when these new requirements begin. And as I mentioned before, the communication side will also not stop once January 1st comes around. We really want to focus on continuing education and outreach and resources for our members as 2027 progresses. So as I mentioned, we are very focused on our stakeholder engagement. This is extremely important to ensuring that we reach all of the communities in Nevada and all the communities where our members work and live every day. So we really want to utilize a broad group to help us meet our members where they are and ensure that this message comes across clearly and that everyone has the information they need in order to stay covered. So some of the very important buckets, I know this is not an all-encompassing list, but certainly our Medicaid district offices, we know it is a very comforting notion that folks can go directly into an office, maybe if they don't have access to a computer or aren't consistently available by their phones. Being able to head into a Medicaid district office is a very valuable resource for a lot of our members. So ensuring that these resources are there, that if they are contacted over the phone, all of our stakeholders are equipped with talking points and scripts for their call centers, whatever's needed. Our health plans, our providers, nearly 50,000 Nevada Medicaid enrolled providers, our navigators, which I'm sure many have heard the announcement. We are distributing grant funding to enroll several more navigators into our program, and our community organizations such as DETR, Employee NV, the Office of Workforce Innovation, United Way. Another side of this is really wanting to make sure that if folks aren't currently in compliance, that we can connect them with resources if they do need to comply in order to get those 80 hours a week if needed. Okay, I know that was a quick overview, but I really want to provide time for Estepona Group to show what they have been working on so far, our sample messaging and some examples of materials and outreach that you may see and that may be distributed to you for distribution to the folks that you work with and see every day. So I am going to hand it over to Chelsea with Estepona Group to walk you through some of those examples, and then we can dive into some questions. So thank you all so much for your time and attention. And Chelsea, I will kick it over to you.
Thank you, Chloe, and thanks everybody so much for your time today. We will run through this as efficiently as possible. What we're going to show you is our messaging strategy, so our approach to communicating this, somewhat complex set of changes to the broader community. And then I'll walk you through some of the provider materials that we're planning to create for you to have access to and to distribute as you wish. Would love to get any feedback you have on that. I want to make sure that any of the materials we're providing are helpful for you and things that you'll use, and that you feel like the members you serve will get benefit from as well. So with that, I'm going to actually turn it over to my colleague Paige, who is joining me on the call today, to talk through our messaging strategy. So give me just one brief second to share my screen. And can everybody see that? All right, and to Paige, I will turn it over to you.
Okay, so a lot of what you'll hear from me is reiterating what kind of Chloe set up with our communication strategy. We want to be a single, voice of truth and understanding for the entire community. We want people to be able to turn to Nevada Medicaid if they're confused, and know that they're going to get really good information. So Chelsea, if you want to go to the next slide.
Yes.
So our approach here, and what we're going to show you, is a messaging strategy. You're not going to see the actual visuals because we're still developing the Nevada Medicaid brand. Once we have that logo and brand finalized, then we will kind of flow that look and feel into all these communications. So what you'll see is I would call a somewhat generic looking materials. They will change, but the messaging is what we want you to focus on today. So the objectives of all these materials, again, whether they're handed out, whether they're paid media, whether it's social media, is going to be create awareness of change and then guide Nevadans to the specific actions they need to do. Excuse me?
Just a reminder to everyone to check that your mic is muted. Thank you all so much.
Okay. So in addition to awareness, we really want to guide Nevadans to specific actions to take to maintain their coverage. We know this can be overwhelming. We know there are a lot of steps, as Anne went over. We do not want to overwhelm people. We want to guide them. So the theme of this campaign, get ready, stay covered. It's got a little bit of that urgency that you have to do something, but it's also got that, if you want to maintain your coverage, you're going to have to be engaged. We're going to provide step-by-step messaging in our communication. We're not going to try to say everything at once, because I think that people will just kind of shut down and have a hard time taking in information. And then we're just going to be very bold in our messaging, very clear, and try to really create a sense of credibility with everything so that there's a similar look and feel so that people know when they see it, hey, that's a message I should pay attention to, because there's probably going to be competing messages out there. Go ahead, Chelsea. So we're going to show you a couple of examples. Oh, there we go.
Clicking too fast.
Medicaid eligibility changes January 1st, 2027. Get ready, stay covered. Here's an example of an outdoor board. Again, very simple, very direct. The Nevada Medicaid logo will be there and guiding everyone back to that landing page on the Health Authority website, where they can really get all the steps, take all the steps they need. New rules, clear steps, act now to keep Medicaid coverage. As we all know, outdoor board is a supporting media. You cannot say a ton on an outdoor board. People are going by at 70 miles an hour. So it's really just to stress there's change and you need to become aware of it and get people engaged and aware. So we also we know that social will be a huge part of this messaging, just because people really used social to get so much of their news and information. So we really want to take advantage of that time that people spend there. And we'll be creating posts that both Nevada Medicaid can post, but also that can be used by stakeholders like yourselves. Medicaid rules have changed, and we're going to offer the 3 things that we want people to focus on. Update your contact information, learn the requirements, know your renewal date. And again, tagging it out with that get ready, stay covered. We know that if we can focus people on a couple simple things, right, particularly updating their contact information, we'll be able to, we being Nevada Medicaid, will be able to communicate with them so much more efficiently and effectively as things change and as people need to have information. New rules, clear steps. Act now to keep your Medicaid coverage. And again, we want this to feel somewhat repetitive. We want people to see these messages in multiple places to understand it's coming from one source, the same source, and to just build their awareness.
No, sorry. There we go.
Take steps to keep your Medicaid. Eligibility rules change January 1st. Again, it's just that call to action. This is not a passive situation. You're going to have to do something. Get ready, stay covered, always reiterating the member's role here. Medicaid rules change January 1st, 2027. Get ready, stay covered. More of the same. So we know a flyer is going to be a really useful tool. So we went ahead and kind of comped up a potential flyer here that kind of summarizes a lot of what this presentation was touching on in a way that is hopefully really accessible to members. What you need to know, and it just summarizes the federal government has changed the rules. Some people will need to show they work, volunteer, or go to school to keep their coverage. The new rules take effect January 1st. These new rules do not apply to everyone, and we just kind of have a little summation of the people who will automatically be excluded. I think that was the word that Anne used, excluded. And then what you need to do, touching on those 3 things we want people to do: update their information, learn the requirements, know your renewal date. There'll be a QR code. It'll take you right to that landing page. Again, just spelling out in as clear and as simple way as possible what people need to do. On that landing page, also know that we will be guiding people to district offices, we will be guiding people to navigators, and we will be providing links for people to kind of self-serve online with updating information through the portal and things like that.
No.
Web header, again, we know a lot of people are going to end up at the Nevada Medicaid website with these communications, and it's just going to be a bold header at the top of the page alerting people that things have changed and they need to do something different than they've done in the past. Then we have a couple examples of just radio scripts. We can think of these as public service announcements. Medicaid eligibility rules have changed. If you have Medicaid, right now is the time to take action to stay covered. Some adults may be required to work, attend school, participate in job training, or complete community service to keep their coverage. The first step, make sure your contact information is up to date. Visit nevadamedicaid.nv.gov. We're here to help you get ready and stay covered. So again, touching on the change, letting people know they need to do something, asking them to update their information, guiding them where to go. TV, it's very similar scripting. It'll just have simple animations. So we just know that video is a medium that many people engage with. So we'll want to definitely be in the video space, but not trying to get overly fancy here, overly creative. The message is the hero. We need people to understand. Just a shorter version. All right, now I'm going to turn over to Chelsea to talk about, in addition to those outreach items, different tools that we will be developing if they're going to serve the audience.
Thank you, Paige. Yeah, I think the big takeaway from all of that is to understand that there's essentially 2 large components. There's going to be our paid media outreach. That's going to be that really big high-level brand awareness. If you think about it like a traditional sales funnel, it's that top-of-funnel awareness. Changes are coming, things are happening, you need to take action. And then a lot of these resources will guide people down that path of all the steps that they need to take. So this will launch with a full-scale push into paid social, paid TV, CTV, which is your connected TVs, radio, streaming radio, traditional radio. We are going to use every tool in our toolbox from the media standpoint. We're going to be able to test those messages right out of the gate and see, make sure people are clicking, converting, doing the things. If they're not, we'll be able to change them in the digital space. So really trying to create some flexibility. One of the things that we know to be successful in these types of campaigns, from having done them a few times, is the resources that our community partners and providers will have available to them. So everything I'm about to go over on this list is going to be available for you to download in a designed format. So we'll share out with you a link, the logistics of if it's on our webpage or in a Google Drive. Chloe and I will sort all of that out to make sure it's accessible for everybody. But you'll have access to these resources in both English and Spanish, and you'll be able to grab them, download them, print them, and distribute them as you need. So that's going to include a double-sided rack card or postcard. Sizing is a little TBD based on the final content we get down to. That'll have a really clear FAQ. Again, that QR code, go to the landing page, learn what you need to learn. We'll provide a large poster, probably like an 18 by 24, something easily printed at, a Staples, for clinic rooms, waiting rooms, wherever, folks might need that information. A counter or plexi sign. This is something that we've seen be useful, where you can insert it into one of those plastic stands at like checkout that says, are you covered? Here's where you need to go. It kind of prompts that conversation between a checkout staff and a member. One tool that I think will be quite helpful is the social media toolkit in both English and Spanish. So we'll provide a series of posts that'll be photos, the content piece, as well as captions, tags, all of that stuff. You'll be able to download those assets and post them directly on your social media. Being a team that manages quite a few accounts, we know how cumbersome coming up with new content can be, so we want to make it as easy as possible. And again, driving home that single point of truth that when you get to Nevada Medicaid, that's where you're getting all of the correct answers. We'll also provide a website copy package, and that'll be some different FAQs, some headers, some things that as you're updating your own channels, things that you own and maintain, easy for you to drag and drop, copy paste those on. Some talking points. We provided dentists in rural communities talking points to talk about the HPV vaccine, and they found it to be incredibly helpful. Just some notes to oh, hey, by the way, have you updated your Medicaid contact information, just to kind of get those conversations flowing. Similarly, a front desk script card. We'll provide content for email and newsletter templates, so things that you can, again, copy paste easily into your own email, whether that's a MyEmma, a MailChimp, what have you. Hold messages and phone tree scripts, lobby and screen digital signage if you have a rotating, screen in your lobbies, and then community partner flyers for your staff. So that's maybe not necessarily clinic staffs, but staffs at, food pantries or libraries or other places where these community members may be, and that staff can be messengers for these talking points. So pretty robust package. These are our next biggest priority of development. So truly as soon as this call wraps today, and I hear that everybody wants all of these things, we will begin development of them in both English and Spanish and make them available to you as soon as we can. And with that, I will stop sharing my screen and turn it over to Chloe. Okay, thank you.
Thank you so much, Chelsea and Paige, for walking us through all of that awesome development in our communication strategy. At this point, we have about 14 minutes left of allocated time. I am going to open it up for questions, and I think we can just do our best to answer as many as we can with the time allotted left in this meeting. I know Anne has been answering several in the chat as we go, so feel free to continue to do that. I am taking down all of these questions and will conduct any follow-up afterwards as needed. This meeting is also being recorded and will be posted on our website along with the presentation that we have presented and provided today. So if there's any questions that we can answer right now with the time we have left, we can just go by raising hands and answer your questions as we can.
Yeah, thank you, Chloe. I would just add, while folks are maybe thinking, want to thank Chelsea and Paige for all their hard work. I will note we as State Medicaid aren't always as focused on communications as we have been, and I'm super excited to have more resources and particular attention on how we can do this better. So in particular, happy to answer any policy questions and we'll continue to do so, but would love to get your feedback on those initial kind of materials and guidance. Does that sit right? Does it feel helpful as a community partner? Is this the type of material that you'd like to be sharing? We really have a chance to shape this to be aligned with what folks want, and I really do want to ensure that that feedback is represented. So just reinforcing that the ask for feedback is it's incredibly helpful and will be reflected there. And I see a question here from Jovan. If a member fails to meet work requirements, will a new application be required once they can demonstrate they meet it? Short answer is likely yes. It depends on the time frame and situation. People do have an opportunity to, within 30 days, kind of submit additional information and be determined eligible. But if they are fully disenrolled from the program because they didn't meet work requirements at that time, maybe they get a new job or a new volunteer opportunity or meet an exemption, they would be applying as a new applicant at that time. Felicia, saying your question, once the meeting is over, will we receive a summary of the questions and answers along with the presentation? Would be happy to work with Chloe on how we can share the answers here, and we will be sure to post all materials to our website.
Just to reiterate what Anne said, thank you for reminding me. We are really looking forward to your feedback and how these materials landed with you, what your first impressions were today. If you can't think of anything right now or while we're on line, I will post my email directly in the chat. I've been very easy to get in touch with and would love, happy to connect offline or communicate via email. If you have some thoughts that you'd like to summarize and send my way later, really just excited to hear how this resonated with everyone and really appreciate your partnership in helping distribute these materials and utilizing what we're working on to help the message reach the folks who you work with every day. So I think that a huge priority of ours is also consistency. So that's why we're really focused on making sure that these materials are available to you as easily as they can be. So if there's something else that we might have not thought of that maybe would work in a current communications form that you utilize, or maybe if there's an easier way that we can get these materials to you, we really want to hear that as well, because it's a huge priority of ours to make sure that not only we are all working off of the same messaging and same resources, same communications, but that you can access these materials easily as well and that you feel comfortable sharing this information and this messaging. So I will send my email in the chat and make sure that we can communicate as all of these materials get finalized and when we start working together to push them out. And Chelsea, I saw you had your hand raised. If there's anything you want to add.
You said exactly what I was going to say, that if not only are you feeling good about the list that we put forth, but if you have another idea of something that your practice or, your group uses that would be better, open to add it to the list for sure. We want everybody to feel like they have what they need. So just let us know.
Thank you all. Seen a couple questions in the chat here. First from Teresa, will the state be collaborating with the MCOs to find excluded members that maybe are in question? Answer is yes, there's a ton of work and I'm really grateful for our MCO partnership. We actually have an in-person meeting tomorrow where we'll be discussing this in depth, but they are working, all 5 of them together, on a coordinated strategy to help spread the word using the same messaging and also work directly with patients to help ensure that folks can meet the kind of requirements and new eligibility factors wherever possible. So lots of work to come from the MCOs. In our notices, you'll see as we publish those on our website, we also are directing people to their MCO if they have general questions. Our MCO call centers will have the same training and information that our teams will have, trying to really ensure that we're using all our resources possible to help get people information. David has a question related to, we've seen a few examples, but will there be a system to check if members need to do the new work requirement? Is it a new software to verify HIPAA and get exempt or work hours required or aligning EVS? Yeah, it's a great question. As you can imagine, there's a ton of systems work going on right now to prepare for January 1. That is not in our current plan for January 1, but it's something we're exploring. It would require a new system or new resourcing. We're also finding ways to get more information in, for example, EVS systems that providers are already using. In the meantime, though, our team is working on a really helpful kind of screener of those 3 questions I shared today, where folks can do kind of a self-check, where a provider can sit with the patient and do it, or anyone else, to kind of go through some questions and help people understand where they may qualify for an exemption or compliance. So trying to find some more manual workarounds for that in the meantime as well. Great question. And then Javon, seeing your question on, for a brand new applicant, is there an established grace period for an unemployed person to meet the requirement or temporary time of coverage? And the answer is the federal regulation requires that when someone applies, you have to look backwards to previous months to determine whether they were compliant in those months before application. States have an option to choose between 1 and 3 months in a row that someone would need to be meeting work requirements. Nevada has shared, and in our March meeting, we talked about this and got good feedback, that we will be only selecting 1 month. So it'll be the month before they apply. So if I'm, Ann Jensen applying in March 2027, I would have needed to meet work requirements or be exempt in February 2027. There's some nuance to a couple of those exemptions, and of course, a lot of detail there, but it is a look back period. If someone does not meet them at the time of application, they would have to wait and apply subsequent months to be able to be compliant with federal law. Good question. Anything else? I'm really grateful for the partnership and how many folks have joined us today. It is a really complex process and a lot of information, so I'm really grateful. And Molly Rose, receiving unemployment doesn't count. So it's about earned or unearned income. And so as long as it would meet that $580, that should likely count, but happy to look into the details. It depends on the particular situation, but unemployment is qualified as one of those $580 of income. And Jessica, on the SUD portion, I think your question is maybe how would someone be considered exempt if they have a substance use disorder? First, we use data wherever possible, so claims data and prescriptions, for example, for medication and assisted treatment. If we don't have any of that data available, people can attest to having a substance use disorder using our medically frail screener. If in 2028, we would need to request documentation. Next year, it's either claims or attestation. In 2028, we would need to request documentation before someone can fill out a self-attestation form based on the federal rules. Good question. Anything else? If intermittent use of Suboxone clinics work. Good question. That really gets into the algorithm of medically frail, like how many prescriptions would be needed. And there's a lot of complexity to what would need to demonstrate kind of active treatment. And so we're actually honestly working through that with CMS right now and with our clinical team. So we'll have that complete code list, as I shared, once that's finalized. But please know that we're working as hard as possible to make this definition really robust and clear and as inclusive as possible within state and federal law.
Any additional feedback or questions that we can address before the end of the hour? Again, I did send my email in the chat. Please feel free to reach out to me at any time. I will make sure that we get your questions answered. We've taken note of all of the questions and feedback that's been submitted in the chat so far. And I will be sending out a follow-up announcement on our listserv with links to where this meeting recording is posted, where the presentation is posted on our website, and any additional resources that we share. So I guess we have about 4 minutes back for everyone on the call. I cannot thank you enough for your time and participation this afternoon. Thank you so much, Anne, for the thorough walkthrough, and thank you, Chelsea and Paige, for the exciting updates on our communications materials. Really looking forward to working with all of you on this throughout the summer. And again, thank you so much, and please reach out if you need anything. Thank you all.
Thank you all for the time. Appreciate it.
Thank you.
Thank you.